Okay. Thank you, everyone. Good afternoon. I'm Karen Hughes from Liverpool John Moores University, and I'm going to talk really about the state of the violence prevention evidence base, not looking in terms of specifically about effect sizes and that kind of thing, but more about what we've got at the moment and what we haven't got. So looking at whether it's fit really to inform a global violence reduction strategy. I'm going to draw most of what I say from the Prevent Violence website resource that we host in collaboration with World Health Organization, Alex here, and also the Centres for Disease Control and Prevention. And this was established really to increase access to evidence on violence prevention. So bringing together published kind of articles on studies of what works to prevent violence within one location to try and promote the use of the evidence base, and also importantly to monitor its development so we can see what kinds of studies are coming out, what kinds of studies aren't coming out, so we can kind of see where do we need to be focusing our resources. It looks at both interpersonal and self-directed violence, but for today I'm just going to look at the interpersonal violence side of it. So this is kind of the front page of the website, and it's got two key resources on here. It's got the evidence base itself, which is a database that contains abstracts of peer-reviewed journal articles. So this is important, it is journal articles, we're not looking at reports on violence prevention evaluation studies. And then a trials register, which is a database containing information of studies that are underway that haven't yet reached the literature. So the evidence base is populated through what we call a rolling systematic literature review. So every 6 months we do a sweep of the academic literature and we look at what studies have come out. And we've used a consistent search strategy to do this for studies published since 2007. We're looking at outcome evaluation studies. So studies that have measured the impact of interventions or activities, laws to prevent violence and have actually measured outcomes in terms of violence, so reductions in self-reported violence or reductions in violent crime, or where that's not possible, closely related risk factors when the study is actually framed in a violence prevention kind of outlook. We're looking at new acts of violence, so it's predominantly primary prevention. We're not looking at interventions with perpetrators or to support victims. And between 2007 and when we did our last update in June 24, we've identified a total of 390 journal articles, of which 351 are in interpersonal violence. And for all of these studies, we get the full access to the study and we quality assess them. And we don't exclude anything based on quality. It's all contained in there. We can just show which are the higher quality studies. And then we extract a range of data on things like violence type, intervention type, study type, setting, geographical, the locations such as school setting, and also around things like collaboration between different countries and research settings. So basically, this is what's happened year on year. And it's a good news story. We can see that the number of studies published is increasing. So the evidence base is gaining momentum. It's gone up from 34 studies in 2007 up to 59 last year. And in the first 6 months of this year, we've identified 29 studies. The types of violence being addressed, it's important to say that many studies will look at more than one type of violence. So this is just the primary focus of them. So there will be studies on self-directed violence that also measure outcomes on like youth violence and things like that. But you can see here that the predominant kind of focus of most studies that are coming out on violence prevention has been youth violence. So almost 2/3 of all the studies that we've identified since 2007 have been primarily focused on preventing youth violence, which means that the evidence base we've got for youth violence is really getting probably quite strong now, but definitely not so for the other violence types. We've got, for child maltreatment, 41 studies since 2007 in the journals, 30 for intimate partner violence, 21 for sexual violence. But the thing that I really want to highlight here, if I can get there, is this, that's elder maltreatment. Since 2007, just one outcome study on elder maltreatment in the entire academic literature. And if you look at what's happening with the global population, I mean, if we really want to address reductions in violence, we need to start looking at this. So we've got, from 1950, 8% of the world's population were aged 60 and over. It's currently at around 12%. It's going to increase to about 21% by the year 2050. 1 in 5 people are going to be over the age of 60. In more developed countries, it's going to be about 1 in 3 people. And this is in combination with a shrinking youth population or young adult population as well. But in fact, it's less developed countries where the numbers are the highest. So between now and 2050, 1 billion extra people aged over 60. And we've made huge gains in extending people's lives. So we think we really need to make sure that it's worth them living that long. So, that we actually protect them and make sure that they're not going to get abused. Particularly as you're thinking things like non-communicable diseases, they're living in resource-scarce environments. We're promoting, less children, we're promoting all these things. And I think elder maltreatment has a much different kind of risk profile in terms of it's not necessarily deprived groups, it's people under stress, people that can't actually deal with it. So it's quite a different profile.
Just a quick question, the different colours on the bars?
Oh, sorry, it's hidden underneath there.
Oh, yeah.
Oh, least developed countries are yellow.
Oh, sorry. Okay.
Less developed regions and more developed regions.
Okay, thanks.
So I'm going to talk a little bit about geographical distribution of the studies here. And this is a map showing how many studies have been conducted within the different countries across the world since 2007. You can see it's very unequal to begin with. There's big gaps here. So Africa, this is Russia, Baltic and Central Asia. This is South America. 60% of all studies come from the United States of America.
This is across all types of...
This is interpersonal violence, all types.
Is this
Sorry.
the setting of the study? Or
Yeah, this is the setting of the study. Yeah, interesting. We do look at who's published it and the relationships between... Yes. Yeah. 90% of all studies come from high-income countries. And again, this is really important, which means that low and middle-income countries account for just 10% of all the published literature on this. That's just 35 studies in journal articles since 2007. Yet they account for more than 85% of violent deaths globally, and more importantly, 98% of all population growth within the next 30 years. And I think that's absolutely critical, because we're not looking at halving violence today. We're getting an extra 2 billion people in this year, 30 years that we're talking about, and they're all going to be in low and middle income countries where we have no evidence. So I thought I'd say a little bit about a couple of these regions, starting with Africa. Predicted to account for about half of all population growth in the next 30 years. That's adding 1 billion people. We've got 11 studies published in the literature at the moment, 7 of them from South Africa, 2 from Kenya, 1 from Burundi, and 1 from the Ivory Coast. What are they? We've got 1 on homicide, which is Richard's changes to firearm legislation. We've got 1 on youth violence, just 1, which is a parenting programme in Burundi. We've got 4 on sexual violence, all of which are skills-based programmes, so things teaching people relationship skills and conflict resolution skills, self-defence skills, 2 in Kenya and 2 in South Africa. And we've got 5 on intimate partner violence, 3 of which are skills-based programmes, 1 microfinance programme, the Image programme, and 1 from the Ivory Coast, challenging social norms. So what stands out here is that the vast majority of what we know about preventing violence in Africa is about gender-based violence. And this is because it's largely been driven by the HIV agenda. So what's really made violence prevention work here is people's interest in driving down HIV and understanding the relationships between sexual violence and HIV spread. And obviously that's been a massive international priority. But I think there's lessons for us there, in how do we actually hook into other people's priorities in order to get more violence prevention studies. The studies are going on, but maybe we can get outcomes, measured as a part of those. All studies in Africa involved some form of international collaboration. 10 of them reported international funding bodies. And I just thought it was interesting, just across these 10 studies, just how many people are interested in preventing violence and how much funding you can generate in that itself. A lot of it from the USA, but also, lots of others, lots of international organisations as well. The thing that stands out to me also here is there's nothing as yet on child maltreatment. I know we've talked about this a lot. but it really is a lack. And I know there is work going on underway in South Africa, Kathy's work and others as well. So this is really important. But the hook that we have here, again, has been talked about, and what's worked in, say, in the USA, certainly in the UK now, is really getting information out of what the relationship between adverse childhood experiences and child maltreatment is on things like social outcomes and health outcomes and non-communicable diseases, because these are going to be the priorities of the future. And if you can let people know how important it is, and they're going to have like burgeoning kind of like populations coming up, that they're going to be really concerned about making sure that they get the kind of like the health outcomes and reduce the social problems. So I'll just look at one more region, Latin America and the Caribbean, going to account for 7% of global population growth, so a smaller impact in terms of growth. 8 studies here, 3 from Brazil, 2 from Jamaica, 1 from Puerto Rico, 1 from Mexico and 1 from Colombia. Again, we have one looking at changes to firearms legislation in Brazil. We have one looking at the impact of restricted alcohol sales hours also in Brazil. Alcohol's been mentioned. I think it's really, really going to be critical in what happens to violence, because in terms of population growth, there's massive new markets for the alcohol industry opening up in Africa and in India, and I think we really need to be helping governments understand, some of these places don't have licensing list systems in place, so that's something we really do need to be supporting. All of the other studies we have are on youth violence. So we've got a home visiting programme in Jamaica, we've got 2 teacher training programmes, we've got parent-child interaction therapy, a conditional cash transfer programme in Mexico, and a multi-component programme to reduce homicides, youth homicides.
Sorry, but this would only be studies that are available in English, right?
We don't limit on language, and if we do find any, then we work with WHO to translate them. But we have quite strict inclusion criteria, because they have to be in the published journal articles. They have to have outcomes specifically to violence and things like that. So a lot of things that are reported in report format won't appear in there, and things that have measured outcomes that aren't specific to violence won't be included in there. So it has its limitations, but the idea was that we would get a concise kind of collection of things specifically with outcomes on violence.
But anything in Spanish or Portuguese, you would be picking up?
That would be picked up as much as we can within the search strategy that we have, yes. And then, I think we have picked up...
There are a lot more studies in Latin America, really.
Yeah, if there are, that's absolutely fantastic. We have what we have with on the resource is a contribute, tell us about a study that's not included on there. And we do get people sending us studies that come through. And when we're sent something, we'll go back to our search strategy and say, why didn't we pick this up? And then try and improve it in order to do that. So there's that ongoing kind of system that we have within there. And certainly just from... today that I've heard about things that haven't come through in our systems that I'll be looking, to see if they're available to us. But I think the thing that stands out here is, again, there's nothing on child maltreatment, but there's also nothing on gender-based violence at all coming through in these systems. It's all youth violence, that's because violence prevention has actually been driven by youth violence in Latin America, because obviously it's been the leading cause of death for young people in terms of very high rates of homicides. We've seen big problems with gangs and with drugs, and these have been international kind of like priorities that have driven funding. So 6 studies are international collaborations, and 5 have international funding, which means almost half are nationally funded, and I think that's important in itself. Just the logos again of the 5 studies that were internationally funded. But I thought what I'd do is say a little bit about the studies that have come through in the last 6 months. We've identified 6 studies from low and middle income countries published in the last 6 months from this, which is in fact 17% of all studies. Now I know it's only, we've still got another 6 months to go, but still, that's kind of positive. And when I heard Teresa Betancourt speaking about her project, I thought, well, why has that not come up in the evidence base? And I looked, and she's actually had 2 papers published in July this year on it. So they're going to come up in the next one, which means we're going to have 8. Now, the most we've ever had before is 7. So this hopefully will mean that we've pushed up our limit. So I'm really excited about that. So what have we got? Well, we've got a life skills programme, a school-based programme in Cambodia. This is actually focused on self-directed violence, so it wasn't included in my previous analysis, but it does measure outcomes for aggression, which links it into youth violence, of course. Reported reductions in boys but not girls. We've got a programme in Turkey reducing children's use of TV, video and computer game use to try and improve their broader health, so BMI and physical exercise and things like that. Aggression was one of their main outcome measurements, and they reported reductions from that. And we've got a programme in India which is an adaptation of the US bystander programme, coaching boys into men, working with male athletes to stand up against gender violence. This found no impact itself on violence perpetration, but I know this has been mentioned before. One of the few differences that we saw between low and middle income countries and high income countries was the fact that high income countries were much more likely to be picking up and testing interventions that have already been used elsewhere. So I'm really hoping that this starts to increase as the evidence base. We can see more and more testing of interventions that have not only from high income countries but also those that have been developed in low and middle income countries and then tried elsewhere. The other 3 studies have been all in Africa. So we've got evaluation of a rape prevention programme in Kenya, a programme in the Ivory Coast looking at the added benefits of men's discussion groups on top of community intervention, importantly in as an area that's been conflict affected. So I think this is really interesting, and I had a look as well to see if the bigger intervention had been evaluated, but I couldn't see anything in a journal article for that, so possibly there's an opportunity to get more in there. And also Richard's firearms legislation reform from South Africa, as well as the reductions annually in firearms and non-firearms homicides. This actually estimated that the changes to the legislation had saved over 4,500 years across 5 years, 4,500 lives across 5 years in the 5 cities. And I think getting this kind of like hard facts out to policymakers and practitioners is really important. A lot of studies talk in terms of effect sizes, and nobody really knows what that means. So if you want to generate action and people to say, wow, you need to put figures to it, and if you can put costs to it as well, then that's really, really important. But I'm going to give a start to the study from the Ivory Coast because this is the first one that was registered in our trials database and has now appeared from a low and middle income country. So I'm really pleased, and I hope some of the other ones that are in there now come through in coming years. We don't have a huge amount of studies within there. It's quite because we have quite strict inclusion criteria. And we're also reliant on people giving us information. So we'll go through, we trawl funders' databases and we see what studies are being funded, and then we'll get what we can from the funders' database, but then we go to the people themselves and we say, can you give us this information? Quite often we don't get responses, which is a shame. But again, I've picked up quite a few studies that I now have already emailed my colleagues back and to say, can you look into this and see if we can get more information to include them? But the good news is 38% of the studies that we do have are from low and middle income countries. We have more studies on intimate partner violence coming through from Africa. We have studies on youth violence coming through from India and China. But most importantly, we have most studies are on child maltreatment. So this is great. We've got studies from Thailand, Kenya, South Africa, Burundi and Colombia, all starting to come through this system, which shows that the evidence base is definitely growing here. But I just wanted to finish. Often things like this, we've heard today how long it can take to get trials going from the start of setting up the thing, getting the funding, getting it all set up and actually coming through to publication. Sometimes you're talking like a decade before you start getting information out. So I just thought, we've talked about macro kind of like analysis of policies, is what we can do to look backwards as well as looking forwards. So I did a really rough analysis or look at the global health estimates for interpersonal violence mortality, just to look at what countries had actually reported a big drop in violence. Obviously the data's not perfect here, but this kind of like the colour coding shows the quality. So the top countries all are reported as having nationally representative death registration data. They've all, in the last decade, had at least a 25% drop in violence, at least a rate drop of 1 or above. Some of them are really big. Some of them have already achieved that 50% drop in violence. So I think there's a lot of work that we can do looking backwards to say, well, what's actually changed in these countries? What can we learn already from what's happened? And of course, there are some countries in there that we're going to be concerned about for the future. So as somebody mentioned, what can we do to protect kind of like societies that are definitely improving and make sure that the political systems kind of like keep up with that. Oh, just to say, this is kind of like the studies that are being included in the evidence base, and legislation policy approaches are one of the top ones, so we do have a lot of skills for doing this kind of analysis if we want to start looking at it. So to summarise, the violence prevention evidence base is definitely growing in the right direction, but there's still major gaps. I think we need to be starting a research programme on elder maltreatment urgently. When you look at what's happening with the population, you know, at the moment it's all about youth violence and child maltreatment, and it's just been forgotten about. I think that's going to be a big problem. We certainly need more evidence for low and middle income countries. This includes more studies, but also more support with publication. There's loads going on, and there's loads that I've heard about just this morning, and you can look at and know is happening, but it's never actually reaching the journal articles, and it's the journal articles that come up in your systematic reviews, and that's what actually feed into your evidence. So I'm sure there's more that we can do as a field to support each other. We need to, of course, strengthen investment in child maltreatment, particularly in low and middle income countries. The opportunities we have for international funding are definitely increasing. You look at all the, I didn't put it up, but all the agencies that are funding the ones that are in the trials register. There's opportunities to link into other international funding priorities, and I think the adverse childhood experience is a really good one for increasing child maltreatment. And we should be looking backwards as well as forwards and learning from countries that have experienced big reductions in violence. Okay. Thank you very much.
Thank you.